MOOC Conversation, Lecture 13. Discussing Room Choices. Doctor: Hello, Mr. Wang. Since you need to stay in the hospital for a few days, let's discuss your room options. Patient: Okay, doctor. What are my choices? Doctor: We have three main types of rooms: general ward, semi-private room, and private room. Patient: What are the differences? Doctor: A general ward usually has 3 or more beds, and you will share the room with other patients. It's the most economical option, covered by basic insurance, but there is less privacy. Patient: I see. What about the semi-private room? Doctor: A semi-private room has only 2 beds, so you share the space with just one other patient. It's quieter and offers more privacy than the general ward. However, there might be additional costs depending on your insurance coverage. Patient: That sounds better. And what about the private room? Doctor: A private room has only 1 bed, and you will have your own bathroom. It's the quietest and most comfortable option, but it is also the most expensive. If your insurance doesn't cover it, you will need to pay out of pocket. Patient: I see. I prefer more privacy so I can rest better. Does my insurance cover the semi-private room? Doctor: Let me check that for you. Yes, your insurance covers part of the cost, and you will only need to pay a small difference. Patient: That sounds great. I'll take the semi-private room. Doctor: Great. I'll make the arrangements. Let me know if you have any other questions. Patient: Thank you, doctor. Discussing DNR and DNI choices. Doctor: Mr. Wang, today we need to talk about your treatment choices. Patient: Okay, doctor. What choices? Doctor: If your condition gets worse suddenly, we may need to give emergency treatment. Today, I want to talk about DNR and DNI. Patient: What do DNR and DNI mean? Doctor: DNR means that if your heart stops, we will not do CPR. Patient: What is CPR? Doctor: CPR is an emergency treatment that helps restart the heart. Patient: What does DNI mean? Doctor: DNI means that if you can't breathe on your own, we will not use a tube to help you breathe. Patient: What happens if I don't get these treatments? Doctor: If we don't do them, you may pass away quickly, but you won't go through the pain of emergency treatment. Patient: What if I choose to get the treatments? Doctor: In your case, CPR or a breathing tube may not work well. If it does, you might need a machine to help you breathe for a long time. Patient: I want to choose DNR and DNI. I don't want those treatments. Doctor: Okay, I will record your choice. If you change your mind, let me know anytime. Patient: Thank you, doctor. Doctor: You're welcome. I will respect your decision. Pre-surgery care. Doctor: Mr. Wang, your surgery is scheduled for tomorrow. I will tell you how to get ready. Patient: Okay, doctor. What do I need to do? Doctor: After midnight tonight, you cannot eat or drink anything. Patient: Why can't I eat? Doctor: Because you will have general anesthesia during the surgery, eating can be dangerous. Patient: Can I take my medicine? Doctor: Some medicine is okay, and some is not. I will tell you which ones you can take. Patient: Will the surgery hurt? Doctor: No, you will be asleep during the surgery and won't feel anything. Patient, how long will the surgery take? Doctor, about 2 hours. Patient, can my family stay with me? Doctor, they can stay with you before the surgery and visit you after it's done. Patient, thank you, doctor. I understand now. Doctor, you're welcome. I hope your surgery goes well. Post-surgery care. Doctor, Mr. Wang, your surgery went very well. How are you feeling now? Patient, I feel a little pain. Doctor, it's normal to feel some pain after surgery. I will give you some pain medicine. Patient, can I drink water? Doctor, yes, you can start with a little water. If you feel okay, you can try some soup. Patient, when can I get out of bed? Doctor, tomorrow, you can get out of bed with the nurse's help. Patient, how should I take care of my wound? Doctor, keep the wound clean and dry. If it gets red or very painful, tell us. Patient, when can I go home? Doctor, if you recover well, you can go home in about 2 days. Patient, what should I do after I go home? Doctor, get plenty of rest, avoid hard exercise, and take your medicine on time. Patient, thank you, doctor. Doctor, you're welcome. I wish you a quick recovery.